Oh, it's just me, and I'm not even presenting.
Hi, Edie.
Hi there. I guess I'm a little early.
We are joined today by the Tribal Capacity Building Center, and we are really excited to share this webinar with you. I'm going to just let you all know that it is being recorded, and we will have the recording on for the remainder of the webinar. And if you have any concerns with that, please reach out to Teresa Campisi. My name is Anne Renaud Avila. I'm the Program Integrity Manager at the National Center on Subsidy Innovation and Accountability. I'm joined today by Janae Williams and Michael McKenzie from our Program Integrity team. And with that, I'm going to turn it over to the Tribal Center for introductions.
Hi, everyone. Welcome to our webinar. My name is Dolores Froa. I am the Tribal SME Construction Major Renovation, joined by my colleague Young.
Hi, everyone. Wingapo. My name is Young Brinson, and I am the Tribal Center's Fiscal SME, and I'm happy to be here. And I will turn it back over to you, Anne, or Toya, sorry.
Great, and we have Toya Bryant from the Office of Child Care joining us today to do a welcome. So I'll turn it over to you, Toya.
Thank you so much, Anne. Hi, everyone. I am so honored to be here today and to assist tribal lead agencies in their program integrity and accountability efforts. My name is Toya Bryant, and I am the Director for the Oversight and Accountability Division within the Office of Child Care. The Oversight and Accountability Division coordinates OCC's federal monitoring of CCDF lead agencies to determine compliance with CCDF requirements and regulations. Currently, OCC monitors the 50 states, DC, and Puerto Rico. We also deliver technical assistance and training to states to promote and encourage sound program integrity practices, especially as they relate to compliance with the Payment Integrity Information Act of 2019. So the goal of our training and TA is to reduce eligibility determination errors, thereby decreasing improper payment error rates. In today's webinar, you'll have a chance to hear about considerations for ensuring program integrity when spending tribal CCDF funds, specifically the various COVID-19 relief funding streams. We look forward to hearing from you throughout this webinar, especially regarding successful strategies you've used. If you are ever in need of support, please do not hesitate to reach out to your regional office. And for more information on CCDF's oversight and accountability, please visit our webpage. The TCBC will be dropping it in the chat for your reference. And I will turn it back over to you, Anne.
Great, thank you, Toya. So today we're going to talk about a few things. We'll do an overview of COVID-19 relief funds, and as Toya mentioned, talk about program integrity tips and considerations. We'll also talk about fiscal management, including spending timelines and waivers. And then we'll have time to talk to a tribe that we have here today to present, the Kenaitze Tribe, who we are really happy to have with us. And then finally, we will have program integrity and fiscal resources to share, and then final questions and time for wrap up. And we'd really like to hear from you all at the end about potential other topics you'd like to learn about related to program integrity and fiscal management. So with that, I'm going to go ahead and turn it over to the Tribal Capacity Building Center.
Hi again, everyone, and I'm happy to get started with you all. So let's begin with the overview of COVID-19 relief funding. All right, so on the screen, we are highlighting the COVID-19 funding overview for states, territories, and tribes, and this resource is a good visual representation of the common requirements and allowable use of funds. And one of the areas we want to highlight is just the common requirements or allowable uses of funds in CARES, the CRSA, and ARP stabilization grants. And on the screen, again, you can see the continued payment and assistance to providers, salaries and wages for providers, allowing assistance to eligible providers not receiving child care development block grant assistance prior to COVID-19 public health emergencies, and allows reimbursement of COVID-19 related expenses that have already been incurred. And we'll drop this link in the chat for you. So give me 1 second, and there you go. And now we're going to just shift a little bit and talk about the allowable activities related to these funds in more detail. Okay, so on the screen, you can see the key resource links there to the left, but then you see allowable activities and then each of the COVID supplemental funding. And notice again that the ARP stabilization funds are a little bit more restrictive, but let's go over it together. So starting with the first, so allowable categories, essential workers or essential worker eligibility goes across all the CARES, CRSA, and ARP supplemental funding. Waiving co-payments for all families only applies to CRSA Act funding. Provider grants goes across all funding streams, as you can see there. Administrative cost limit to 15% goes across all funding streams, but have a specific set aside under ARP Act stabilization grants, which we will discuss this more on later on. And then allowable CCDF activities goes across all of the funding streams as well. So you can see again that ARP stabilization is the most restrictive, but the others have way more flexibility. And so we'll review some of those later on. But for now, I will turn it over to Janae to talk about COVID-19 relief funds, program integrity tips, and consideration.
All right, thank you, Young. All right, so as Young stated, throughout this next section, we will cover program integrity and accountability activities, tips and considerations that lead agencies can think about implementing with their COVID-19 relief funds. But before we get into that, we thought it important to lay a foundation, and which is that when thinking about COVID-19 relief funds, program integrity and accountability activities, remember COVID-19 relief funds were distributed under CCDF, and applicable program integrity and accountability requirements should be applied in the administration of the funds. These requirements include, and they're on your screen, processes to ensure sound fiscal management, processes to identify areas of risk, processes to train childcare providers and staff of the lead agency and others that administer COVID-19 funds on program integrity requirements, and integrity. And in just a second, we'll take a deeper dive into these areas on your screen. But first, we wanted to talk about some other applicable areas, or highlight as a quick reminder, other areas that, or other regulatory requirements that are still applicable as well. And these include processes to identify fraud and other program violations, and processes in place to investigate and recover fraudulent payments and impose sanctions on clients and providers in response to fraud. So we did want to highlight those regulatory requirements just to lay a foundation as we get to talk about the rest of the section as it relates to program integrity and accountability activities. So on your screen, you'll see a framework, the internal control system. Now, the internal control system is what we'd like to use today as we talk about those regulatory requirements at 9868A. And it comes from, the internal control system comes from the Standards for Internal Control in Federal Government, the Green Book, which sets standards for effective internal control and effective internal control system, and provides an overall framework for designing, implementing, and operating an effective internal control system. Now, while this framework is not required to be used by CCDF lead agencies, there is a benefit to using the framework as a guide for implementing program integrity activities for COVID-19 and or CCDF processes and funds. The standards in the Green Book are organized into 5 components that you see on your screen. Each of these 5 components contain several principles And today we'll look at some of those principles agencies can consider. All right. So remembering 9868, and I'll say this quite a few times, you have sound fiscal management, identifying risks, training providers and staff on program integrity, and evaluating internal controls. So our partners at the Tribal Center will discuss sound fiscal management in just a moment. But first, I'd like to show the correlation between the other requirements and an internal control system's components and principles. So starting with the control environment. The control environment includes principles of oversight and enforcement. Here, an agency can consider establishing an oversight body that is responsible for ensuring controls are in place, and this oversight body should have the ability to enforce accountability. Next is the risk assessment component. The risk assessment using a risk assessment within the control system can assist an agency in identifying risk areas through appropriate risk models for administrative and operational activities. An example of an operational activity is your control activity or your internal control. For example, your agency may want to compare the level of risk to a defined agency tolerance level, or compare the financial impact of a risk activity and a control activity. Risk assessments can provide insight on where potential fraud or administrative errors can occur, and it provides an understanding of where the risk areas are, which can help an agency clearly define the objective of an internal control activity. As another benefit with establishing the system, having an internal control system can also allow an agency to speak to their program integrity efforts to stakeholders and also in their CCDF plan. So going back to the oversight body, one other thing here, an important note is that the person or group of persons that analyzes the response to each program integrity activity, regardless, well, let me say that again. The person or person within the staff of the oversight body who's analyzing the responses of the impacts, whether these impacts decrease or increase or have no significant impact, should use that data to guide them as they implement additional internal control activities. And moving to the control activities or internal controls, regardless of an internal control activity, a lead agency should consider asking 3 questions when designing an internal control activity. Is the control activity relevant to the objective or risk area? Is the control activity timely, meaning does it react, detect, or prevent the risk area? And is the internal control activity strong? Is it accurate when it's providing information, and is it reliable? Does it consistently provide this information to the lead agency? Now let's look at the last 2 components, which are information and communication and monitoring. So with information and communication, an agency can leverage their administrative data to improve their program integrity outcomes and communicate the effectiveness of program integrity activities. However, it is important that all administrative information and data, internally and externally, is accurate and relevant, meaning quality information. And the agency creates policies and processes for communicating and receiving the information both internally and externally. Communication also provides to agencies the opportunity to train and inform others on program integrity requirements and program integrity. On program requirements and program integrity. Tongue twisted there. And lastly, we have monitoring. So leadership, senior management, dedicated staff should monitor the internal control system activities, evaluate the results of risk assessments, and the steps to mitigating the deficiencies, checks and balances here. While this is a broad framework, the internal control system, it does help agencies think about the work that they're doing. And we do understand that the work could look different across CCDF and COVID-19 programs. However, the general concept of the framework can still be applied for tribal lead agencies. Now let's switch gears here just for a second and look at a few examples of internal control activities. Now here, we'll look at quality reviews, documentation, and reports and reporting for our examples. So in quality reviews, internal control activities could be the ideal or the process of implementing processes for monitoring and tracking of COVID-19 relief funds or any program activity, using administrative data to support program changes and strategies related to the use of COVID funds, implementing an oversight process for written agreements between the agency, contractors, intermediaries, vendors. And then in documentation, you have creating a record retention policy or process, ensuring related financial records are accurate and complete, regularly reviewing COVID-19 program records. This process will allow an agency to ensure record retention policies and processes are being followed. And then in reports and reporting. Here we have creating program performance reports for management and leadership. A simple Excel or Word document could suffice. Documenting procedures for preparing the 696T reports and other required reports to include the data sources, the funding streams, and accounting practices used to compile the reports. And conducting management and leadership reviews of reports prior to submitting to ensure completeness and accuracy. And lastly, we have creating red flag reports and system alerts specific to COVID-19 relief funds. Now, our tribal center partners have created a framework designed specifically for lead agencies. And for that, I would like to welcome back our tribal partners, and I will pass it to you, Dee.
All right, thank you. Thank you for all the information, Janae. We do hope that is very helpful for all of you here that are joining us in this webinar. All right, so here on the screen, you should be able to see, oops, I think I might have clicked it. Okay, there it goes. On the screen, you'll see the Tribal Child Care Management System Framework, which is a visual representation of the systems that make up CCDF administration. The second ring of the framework image is the Program Management, Planning, Integrity, and Accountability System. Here, the CCDF administrator ensures compliance with applicable regulations, including program instructions, information memorandums, and ensures compliance with applicable regulations and provides oversight of all of the expending of funds. Integrity and accountability, just like management and planning, should be incorporated either with a regulatory standpoint or an agency standpoint. Tribal lead agencies must implement integrity and accountability activities to support the agency's goals and objectives, including the development of written policies and procedures, methods to monitor and enforce the policies and procedures, activities to prevent fraud, identification of improper payments, and recovery of those payments. So as we continue our discussion around the tribal management framework, we've been discussing with each of our tribal lead agency having their own unique management system. TCPC has an activity on the website that you could use to identify your internal systems to help you identify key people and departments with your tribe. And we can provide that link in the chat box for you to access that. So you're able to create this wheel within your program. So let's shift a little bit here on talking about accountability. Let's focus on accountability. Within the CCDF program, we can highlight three distinctive accountability systems. We have fiscal accountability, program accountability, and process accountability. Fiscal accountability and CCDF refers to the appropriate spending of public funding within the federal and state laws in conjunction with proper accounting or sound fiscal management. Program accountability is a result of the CCDF program implementation by this Tribal Lead Agency according to the CCDF regulatory requirement. So lastly, process accountability, which refers to the daily administration of the CCDF program in accordance with the policies and procedures that support the CCDF federal regulations. There are various activities that exemplify each of these three types of accountability. So I'll read those here. Ensuring the agency is in compliance with terms of the grant, activities that monitor fiscal operations, guidelines to ensure proper documentation to support activities, appropriate oversight of programs, assets, property, and income, methods to identify and recover improper payments, and support that overall functions of the accountability system. Needless to say, an agency can have great strategies, but without prior internal controls, their efforts can be null and void. So a guiding question to think about around your program is, does your fiscal staff have access to appropriate training regarding all aspects of the fiscal management? And how often are they receiving training? Have you ensured your current internal infrastructure, such as like your accounting staff and the software that you might be using? Another guiding question is, another guiding question is in conjunction to what I just mentioned is, have you ensured your current internal infrastructure, such as accounting staff and software, is able to support the administration of the funds that you are receiving? Are you making plans to ensure it does support administration of the funds? So just an example, when contracting with intermediaries who may be consulting firms or individual contractors, think about what terms and conditions are included in that contract. For example, be sure to include a clause that vests the tribal lead agency and or the tribe as the sole proprietary of all intellectual property in all forms. An example like digital, written, and oral. You might also want to consider adding a clause that ensures that contractor or consultant train tribal staff during the length of the contract to alleviate the skills and capacity of internal staff members. So let's start reviewing the fiscal management system. To ensure you can successfully manage and administer the American Rescue Plan, the ARPA Act, Child Care Stabilization Grant Funds, it's important that you have a sound plan in which your fiscal staff and CCDF administrators are working in unison. The ARPA Act, Child Care Stabilization Grant Funds, you also have the flexibility to utilize the funds on a variety of spending categories that are exempt from typical CCDF spending requirements, and lead agencies have wide discretion on how subgrants are formulated. So before we dive in, it would be helpful to first hear about strategies you're currently using in handling the financial and programmatic aspects of the program administration and management. This may include your timeline or tools of developing budgets, any tracking mechanism for obligations and liquidations, your audit history, or any other fiscal resources currently in use. So if you're welcome to take yourself off mute or even just add your type of strategy that you've been using in the chat. We'll take a look at those and review them as we are going along. So we'll go ahead and pause for a minute here and see if anybody has any. Again, what are your strategies? What have you been doing to really get things moving within your ARPA stabilization dollars that you received? And again, you can enter that information in the chat, or it's a lot quicker if you just speak over the line and unmute yourself. We'd really appreciate that. And your peers are here within the room that would like to hear those strategies. Maybe they need some help and support. That would really be great for you guys to make that conversation. So. All right, I don't see any in the chat box, but as we're moving along, you might be thinking of those. but I do encourage you to view available recordings of this ARPA Act Stabilization Grant webinar if you have not already, that it'll definitely assist and guide you through best practices and deepen your understandings of policies and procedures. Let's talk a little bit about fiscal management system. Good fiscal management systems is one of the keys to having a very successful program, and includes having reliable and accurate accounting systems and process when dispersing CCF funds. It is important to determine who your point of contact is within the tribe's fiscal department, and meet with them regularly to monitor your budgets, cost allocation plans, allowable expenditures, and then drawdowns in preparation for your regular tribal fiscal audits. The internal control mechanism can assist the agency in meeting goals and objectives within your tribe's fiscal management system. So some elements involved in effective fiscal systems include budget, cost allocation plans, Office of Management and Budgets, or OMB allowable expenses, fiscal reporting, your internal controls, policies and procedures, and audit. It is a good idea to also have copies of your tribal fiscal policy procedures for your reference to have an effective system. The following process should exist at a minimum: process to ensure sound fiscal management, processes to identify areas of risk and fraud prevention, processes to train childcare staff and providers regarding your program requirements and integrity, regular evaluation of internal control activities, and disallowance procedures. So some questions to think about to guide you through some of these processes is, have you reviewed existing policies and procedures to determine whether they should be updated or not? Another question is, if necessary, have you drafted new policies and procedures, and what is your process for this? Consider aligning this with the new CCF plan to diminish the need for completing an amendment. Another question is, does your current tribal laws coincide with or sync up with the ARPA Act Child Care Stabilization Grant financial requirements? And if not, have you thought of a contingency plan to overcome that challenge? Another question to think about as a guiding question is, has your tribal leadership been involved in aspects of your financial management, and to what extent are they engaged? So in hopes that this tribal fiscal management system is something helpful that you could take back and use within your program. I will now turn this part of the presentation back over to Mike.
Thank you, Dee. Great information. And I know we've thrown quite a bit at you folks already. The participation is great today. We've got over 100 people calling in for this webinar. So thank you for taking the time. And now we're going to give you a chance to maybe share some information with your peers. So we're curious about any implementation strategies for internal controls that you have. And I would say that includes looking at it in terms of continuous quality improvement. You know, do you review those or reevaluate after a certain amount of time, whether it's a red flag report or how you conduct quality control reviews or even data matching? So we're curious about that. If you implemented any internal controls more specific to COVID-19, sure your peers would love to hear about that from you as well. And then along that same line, any challenges to implementing program integrity or accountability activities that you have had. And so again, just like with what Dee did, I'm going to ask you to put any comments in the chat and we'll share. Otherwise, if you do want to come off mute and talk on the phone, just let Teresa know and we can take care of that too. So Valentin Santiago indicated that program staff regularly meet with our accounting team to go over expenditures versus budgets. So that could include the status of balances, reclasses, adjustments, just ensuring that we're on track and expending funds. And I think that's a really good point, because again, you should always be reevaluating. We know we've been in some times lately where things have changed so much. And so to be able to reevaluate that and see how you're doing, I think is a great strategy. Anybody else?
This is Jennifer Anderson, and I work for Kenaitze Indian Tribe. And part of our internal control was that we were helping childcare centers with our CCDF, obviously CCDF funds, but we were helping them with utility payments. And instead of paying the vendor of the childcare, we actually paid the utility provider directly. So it was just one way for us to verify.
Yeah, great idea, Jennifer. Thank you. Anybody else have anything that they want to share? Something that's worked really good for your agency, something that your peers could really benefit from? Anybody have any particular red flag reports that have worked really well for them? Here we go. Dixie indicated that the Seminole Nation of Oklahoma uses the MIP accounting system, and all requisitions for purchase go through a series of approval signatures from director procurement monthly. Monthly expenditure reports are provided by the grant. Anytime you can do stuff to even separate responsibilities in terms of payments, and not having just one person do the whole thing is a great strategy. Thank you, Dixie. And let's see what else we have here. Valentine says, just having regular meetings so program and fiscal communications are kept open. That's a really good point. Just, you got to keep talking, right? Make sure that everybody's on the same page. And Kim indicated a big help to us is now that we've added a program analyst to the child care programs team. She works closely with our tribal accounting program department. So great that you were able to add that resource. Anybody else? We're going to give you just a couple more minutes here. But some really good tips here, folks. We appreciate it. Any challenges that anybody had to deal with as you implemented program integrity changes or accountability activities? All right, I'm just going to check with the rest of the panelists. Janae, Young, Dee, anything you want to add?
Nope, I think we're good to move forward.
Okay, we got one more thing here from Laura. New staff who aren't familiar with federal requirements. And I would think that's a challenge, right, Laura? It takes a little while to get people to understand these programs. I come from a SNAP, WIC, and Medicaid background, and it took me a while to understand all the loopholes and all the requirements that are different with CCDF. So thanks for adding that, Laura. I think at this point, just to make sure that we have enough time for everything else, I am going to turn it back to Young to talk a little bit more about some strategies for measuring and timelines and waivers for relief funds as well. Young?
Thank you, Mike. All right, you guys. So again, let's start by going over the COVID relief funds, spending timelines, and waivers. And we'll start today with CARES. Alrighty, so on March 27th, 2020, Congress approved $3.5 billion in funding for state, territory, and tribal child care and development fund lead agencies through the Coronavirus Aid, Relief, and Economic Security Act, known as CARES. And this funding can be used to prevent, prepare for, and respond to COVID-19. So as you can see on the screen, there's allowable spending categories, exemptions, administrative cap, key dates, and tribal considerations. And so this is our spending at a glance document, which is also found on the CCTN website, and we can put the link in the chat for you as well. But let's start with the allowable spending category. So with CARES, you could do things such as supporting, providing support to qualified providers, including tribally operated centers, in one or more of the following categories. So allowable CCF activities that you're already aware of, continued payments and assistance to child care providers in case of decreased enrollment or closures, cleaning and sanitation and other activities necessary to maintain or resume operation of programs due to COVID-19, any pre-award costs incurred from January 20th of 2020 through the public health emergency period and prior to the effective date of CARES, which was March 27th, 2020. Now let's look at some exemptions. So tribes of all allocation sizes are exempt from the 9% quality improvement requirement, and tribes with medium and large allocation sizes are also exempt from the 3% quality improvement requirement, as well as the 70% direct services requirement. With the administrative cap, there is a 15% administrative cap, which is similar again to your normal CCDF mandatory and discretionary funds. And then you have your key dates. So obligation and liquidation deadlines of September 30th, 2022 to September 30th, 2023. And then lastly, you have tribal considerations. So for tribal lead agencies, including any Public Law 102-477 grantees who operate certificate programs, grants, or contracts, or tribally operated centers, you could consider funding child care providers to retain staff. You could also, think about supply building grants to providers for startup costs, equipment, and supplies, grants to providers for virtual training and professional development activities, as well as emergency grants to providers to support emergency child care services to essential workers. So those are all possibilities. And I do want to highlight, let's say if you have a tribally operated center only, similar to providers, tribally operated centers can utilize their CARES funds for a variety of purposes. So perhaps you don't have the capacity necessary to make the upgrades or repairs you need, but you can consider using CARES funds to contract utility staff or janitorial services for sanitation of your tribally operated center. So those are all some things to think about. Now let's segue to CRSA. Alrighty, so now I'll briefly review CRSA funds, which are the Coronavirus Relief and Response Supplemental Appropriations Act funds, which was signed into law on December 27th of 2020. And the CRSA Act provides resources to address the immediate needs of families struggling to pay for childcare and childcare providers facing financial uncertainty due to the COVID-19 pandemic. So again, very similar to the last slide, you have allowable spending categories, exemptions, the admin cap, key dates, and tribal considerations. And so let's go over some of the allowable spending. So you could, for instance, again, any other allowable CCF activities that you're aware of are possible, paying wages and salaries of childcare workers, which is also important for tribal operated centers to consider, supporting the stability of the childcare sector, any virus mitigation and response policies and procedures, and any assistance to providers not participating in the subsidy system prior to the pandemic, and administrative and system investments or investments, sorry. I'm tongue-tied today. But those are all possibilities. And then you can see there your exemptions. So tribes, again, of all allocations are exempt from the 9% quality improvement spending requirements, and tribes with medium and large allocations are exempt from 3% infant toddler quality improvement requirements, as well as that 70% direct services requirement. But regardless of allocation size, no waiver required to waive, there's no waiver required to waive co-payments, and the CCDF plan amendments needed if not already included. So just a reminder for you. And then again, just like CARES, there is an admin cap of 15%. And then you'll also see your key dates. And then lastly, the tribal considerations. So again, for tribal considerations, supporting essential workers without regard to income eligibility, any reimbursement costs incurred to prevent, prepare for, and respond to COVID-19 prior to the enactment of the CRSA Act, and required to aid providers not participating in subsidy for program prior to the pandemic. So those are all possibilities. And I do see a question in the chat from Kathleen Adams. What are some examples in the CRSA of system investments? So I would say, you know, anything that can help support the admin of your program. So you could consider like maybe purchasing Child Plus if you don't already have it. Maybe you need some other systems for billing that you don't already have to make it easier for you. All those are some types of investments you can use your funds for. And remember, CRSA funds are extended if you have an approved waiver. If you applied for it, some people apply for obligation and liquidation extensions, and some of them also just, you know, chose one or the other. So just make sure you check in with your regional office or your regional program specialist to make sure that you know about your waivers.
Young, there was also a question here about, in the session, will we be covering a thorough definition of the obligation?
Yes, we will.
I know you have a slide of that with obligations and liquidations. Yep. So the answer to that is yes, and we'll get to that shortly. Thank you. Yes.
Thank you so much, Mike. And thank you for these questions. These are great.
Yeah.
Of course, Kathleen. All right, so let's look at some other, and I just want to, again, because I just like talking about also tribal operated centers. For CRSA, there's another opportunity to pay wages and salaries for workers in addition to the care. So tribal agencies that directly operate their child care facilities may also grant leave to their own staff using CRSA Act funds to pay for the leave as an example. So those are some other options. And now let's segue to ARP, but the 20% set aside. So again, this is for all grantees. And again, same exact columns. So let's start with the left. So in the first column, we have the allowable spending categories, and these include administering stabilization support, any activities to increase the supply of childcare, technical assistance and support for subgrant applications, publicizing the availability of subgrants, and technical assistance for providers to meet requirements throughout the subgrant. And then in the second column, it states that administrative funds are exempt from the 9% quality improvement spending requirements. And again, tribes with medium and large allocations are exempt from that 3% infant toddler quality improvement requirement, as well as the 70% direct services requirement. And then again, you have in the third column, you'll find the administrative cap, but this time it's 20%, which is unique to only this funding. And the key dates for the administrative portion of the ARP Act Child Care Stabilization Grants are the same as for the funds we previously discussed. And finally, the tribal considerations include the cost of staffing and technology needed to administer your subgrants, upgrades to for data collection and technology to administer subgrants or collect that data, establishing a child care provider licensing or monitoring program to build program capacity, or you could hire an intermediary to administer your subgrants. And this set aside for administration could assist you with increasing that overall capacity to implement your funds. So definitely take a look at what you could do with your ARP funds as well, because you know deadlines for extensions are coming up. And also there's plenty of spending strategies that you can implement. So definitely take consideration for this. And I see another question from Kathleen. Would you be able to email a template for a subgrant to a provider? I think that we do have some examples. So after this call, Kathleen, I'll get in touch with you and we can circle back on that. So thank you for asking that question, because that's a good question to ask regarding this. So we will definitely take note of that. Of course, Kathleen. And so I'll continue. But this again, stabilization 20% set aside, lots of options to get that money out the door. Now let's segue to the ARP Act funding to child care providers. So the ARP Act Child Care Stabilization Grants were enacted to stabilize the child care sector for states, territories, and tribes in a way that rebuilds stronger child care systems. So let's move this at a glance document again, starting with allowable spending categories. So the first column, we have some allowable spending categories for subgrants to qualified providers. which include tribally operated centers and one or more of the following categories. And remember, if you operate a tribally operated center, you can spend your funds directly on your tribally operated center if you do not have a subgrant program. So personnel costs, benefits, premium pay, and recruitment and retention are all possibilities. Any rent or mortgage payment, utilities, facilities, maintenance and improvements, or insurance, PPE, cleaning and sanitation supplies and services, or training and professional development related to health and safety practices, purchases of or updates to equipment and supplies to respond to COVID-19, goods and services necessary to maintain or resume childcare services, as well as mental health supports for children and employees. And at least 80% of the funds must go to subgrants for qualified childcare providers, so keep that in mind. And in the second column, we list some of those exemptions. So tribes of all allocations are exempt from the 9% quality improvement spending requirements. The tribes with medium and large allocations are exempt from 3% infant toddler quality improvement requirements, and then the 70% direct services requirement. And then we have, again, that third column, which identifies your administrative cap, and that is, again, 20%. Then you have your fourth column, which are the key dates for obligation and liquidation, as well as some additional clarifying information. And the last column, again, we have which includes Public Law 102-477 grantees that operate certificate programs, grants, or contracts, or tribal operated centers. You could consider subgrants that must, consider these options, Subgrants must go to qualified providers, as you know. Tribal agencies may choose to award all their IRP Act stabilization grants or to their tribal operated centers, which I stated. Subgrants may be applied to current or past expenses. Funds are available to qualified providers regardless of previous federal assistance, including CCDF and other COVID-19 funding. And tribal agencies could consider determining required documentation for providers to use of subgrant funds. So this is another great resource to print out if you don't already or haven't seen it before, but definitely make use of this because you can print them and pass them out. Maybe you want to make a clip folder binder for all of them. But I would say some things to consider, some questions to consider are some factors that influence personnel costs, such as ratios and group sizes that affect staff pattern salaries and benefits. And maybe think about increasing salaries and, to your staff and the impacts it could have to your program. And maybe you're like, oh, have providers thought about considering offering benefits such as health insurance for employee retention, maybe? So there's lots of questions to consider when implementing your ARP funding, but we are here to support you. Now let's go to our last COVID-19 funding. So lastly, we'll review the ARP Act discretionary supplemental funding, and tribal agencies have an opportunity through these funds to expand access to high quality childcare and move toward a more equitable childcare system. And the childcare systems in tribal communities should meet the development needs of children, provide parents with the true choice and equal access to childcare services that best fit their family's needs appropriately, compensate an essential and skilled childcare workforce, and lastly, facilitate a robust childcare sector. So the CCF discretionary supplemental funds can also be used to support providers, including those tribally operated centers, to do the following. So addressing any inequities in childcare services, expanding access to high quality childcare systems, increasing access to financial assistance for families, expanding outreach to families on childcare assistance, supporting vaccination information, and lastly, again, any of those allowable CCF activities that you're already aware of. So the stabilization funds are exempt from those 9% quality improvement spending requirements. And similarly for discretionary supplemental funds, tribes of all allocations are again exempt from 9% quality improvement, and tribes with that medium and large are also exempt from that 3% and 70%. And then very different though from the stabilization is the admin cap goes back to that 15%. So make sure you're aware of that. Now, then you have your key dates, and lastly, those tribal considerations. So let's go over a few. So building the supply of childcare for underserved populations, increasing wages for childcare workers, including increased access to health insurance and other benefits, increasing provider payments, and providing childcare assistance for essential workers regardless of their income. So you could consider working with other partners in the community and adult care food programs, sponsors to recruit and support new family childcare providers. Maybe you want to work locally and regionally to identify childcare deserts and focus funding on developing capacity and programs in those areas by contracting with consultants or offering hiring bonuses or startup mini grants or providing technical help. And for a tribally operated center, you could use your ARP funds in many ways, similar to your other COVID supplemental funds, such as CRSA and CARES. So remember, you have lots of options here, so definitely take them into consideration and really think about what you need. So again, are there any small roof repairs necessary for your tribally operated center that you want? Does your bathroom fixtures need updating, or do you need to update your sidewalks? So all those are questions that you want to think about when considering the uses of discretionary supplemental funds. Alrighty. And then I just want to point out, since we were talking about those administrative costs and all of those things, let's talk about some allowable activities for each of them. So on the screen, you'll see this nifty administrative costs in CCDF, CARES, CRSA, and ARP for tribes resource. And this resource does provide an overview of the admin caps and allowable uses for each funding stream. So as a state, territory, and tribal lead agency continues responding to coronavirus or COVID-19 rather, it's important to understand the similarities and differences among the various COVID-19 funding packages, again, as we mentioned, and the ways funds can be used to support administrative costs. So if you're looking at this, you can see that the 20% is kind of grayed out and it's over to the right. And underneath it, the ARP stabilization grants have their own allowable activities, which could include administering sub-grants, again, including those for staffing, information technology and data systems, or performing activities to increase the supply of childcare. And then to the left, you see ARP supplemental, CRSA, CARES, and your regular CCDF funding, which all have that 15% cap. And then underneath that, you will see the allowable costs. So providing salaries for staff, performing administrative functions, preparing reports, facilitating complaints, coordinating activities with other childcare, early childhood development, and before and after school care programs, paying for accounting services or paying for audit services. And there's many more listed there that we would love for you to definitely take the time to review, and we can pop that link in the chat for you as well. Alrighty, now here, speaking of all of these deadlines that you see, these key dates, this leads us into understanding the difference between, again, obligation and liquidation, which are two financial terms that you should remember as well as important, because this is very important for your timeframes, especially with how fast they're coming up. So obligation, must remember, is an action that commits the funds, such as a legally binding agreement between two parties for purchase of services, supplies, or equipment. And CCDF does allow for tribes to use their own definition of obligation. So this should be the same definition that applies to all procurements, and CCDF should not have a separate definition. And then liquidation generally means the payment of funds to a third party as a result of an obligation. And to put that simply, think about this again, because it's the one that we always talk about in here, is with obligation liquidation is think of it as a credit card. So again, you will incur expenses on your credit card, and then you must liquidate or pay them out eventually, right, before your payment dates. So it's very similar. So some things to think about regarding just in general with obligation and liquidation is, does your fiscal department communicate regularly with the programmatic departments to ensure obligation liquidation dates are accounted for? Because this is very important with respect to your waivers and how they impact payment requests. So definitely make sure you are aware, and just also be aware if you do actually have a tribal definition of obligation, because if you don't, then the federal definition will supersede. So determination of whether funds have been obligated and liquidated will be based on applicable tribal, state, or local law. And if there is no applicable tribal, state, or local law, then again, definitions at 45 CFR 75.2 apply. And in cases where tribal, state, or local law does not apply, here is what 45 CFR defines obligation and liquidations as something very specific that you can find located at that regulation. So definitely write it down if you don't already have it for 45 CFR 75.2. But it's very important to manage and keep track of your spending timeframes by year. The funding was allocated in order to ensure the timely distribution of funds to childcare providers. in an equitable manner by the Tribal Lead Agency. And on the screen, again, you'll see a helpful chart that will assist you in staying accountable. And you'll notice that it goes all the way to 2027. And so let's think about some terminology that you see on here, just so you understand the acronyms. So the grant year, or GY, refers to the federal fiscal year during which funds are awarded, although tribes may liquidate CCDF funding streams in later fiscal years. And then the FFY, or federal fiscal year, refers to the federal fiscal year period from October 1 through September 30th, during which tribes may spend funds awarded in the current and prior years. And remember, the obligation liquidation periods do not apply to grantees who operate under a Public Law 102-477 consolidated plan. Okay. And to help you with your obligation and liquidation, we do also have this nifty resource, which is obligation liquidation methods, policies, and procedures. So now that we've discussed timeframes for spending, let's think about some ways to obligate funds. Okay, so it's important to work closely with your fiscal department, as I mentioned, in order to ensure that everyone is tracking both the incurred expenses and those that have been paid out. And facilitating this may be daunting, of course. However, it's a good idea for a number of reasons. So let's think about, as you're trying to assess how you're going to obligate your funds or what could constitute an obligation, think about what, if any, modifications you might need to make to your existing policies or procedures to administer your COVID-19 funds to meet the needs of your community. And think about what processes you have or policies that exist for what constitute an obligation, as we mentioned, because if you have an obligation definition of your tribe, it will apply, but if not, again, the federal definition will supersede. And this document for tribal agencies provides general definitions and the examples of actions that could potentially count as an obligation if it meets applicable tribal law and policies. And remember, each tribe's financial management system should determine both how obligation is defined and the process for purchasing services, supplies, or equipment. And to ensure sound fiscal management, tribal agencies must obligate and liquidate, again, your CCDF funds in accordance with the CCDF final rule. But some of the examples that you see here that could constitute an obligation or liquidation could be, again, contracts, which you're aware of, any cooperative agreements, any approved itemized budgets might be considered an obligation, purchase agreements or purchase orders, any tribal child care vouchers or certificates, letters of commitment, memoranda of agreement, subawards, and any tribal resolutions. Okay, so in order to correctly obligate and liquidate your funds, it's important to read the guidance related to each supplemental funding award. And we can put this link in the chat for you as well. Oh, and thank you for doing that, Teresa. All righty, so now this brings us to the waivers. Okay, so currently, approved waivers for extraordinary circumstances for requirements impacted by COVID-19 for tribes have a 1-year duration, expiring a year from the jurisdiction requested effective date. So due to ongoing uncertainties of COVID-19, tribes had the option to request those renewals for their current waivers for extraordinary circumstances, as long as the waivers were submitted by the deadline of January 28th, 2021. So tribes who apply for and receive their retroactive grant year 2019 waivers, for example, are reminded that these funds must be obligated and liquidated by this year, September 30th, 2023. And note that some grant year 2019 retroactive fiscal waivers are still in the final processes of approval and will be issued soon. And as the deadline for requesting all of these waivers has passed, please prioritize obligating and liquidating these funds, as the extended obligation liquidation deadlines, again, are quickly approaching. So for further information, or if you need assistance regarding your waivers, make sure to reach out to your regional office at your earliest convenience. Okay, and with that, I will pass it off to Mike.
Thank you, Young. Hey, there were several questions that came in while you're chatting, and we probably can't answer all of them, but I thought maybe we could take a look at a few of these.
Let's do it.
Okay. People were asking if there was an ARP mandatory fund cheat sheet.
An ARP mandatory fund cheat sheet, so that you're with ARP funds, remember, you were given your mandatory funds like you always are, but then you got a mandatory increase, and that mandatory increase will be whatever it was determined by, and is listed on the tribal CCDF allocations for any of your grant years or fiscal years. And that increase will not go away, so it's permanent. Now for the cheat sheet for mandatory, we don't have one, but we can again provide that list, our spending at a glance document, because again, the ARP mandatory funds are just an increase to your existing CF funds.
Sure.
So any allowable activities, you know what I mean, that would count.
Yeah. And
apply.
remember, folks, these are your experts. So if you have questions after today's presentation, reach out to your regional office and they will get you the answers that you need. April asked if there was a set of policies and procedures to follow, as well as a template of the application for the stabilization grants. And all of these slides today will be shared with all of the participants. I think it's great information and it looks really pretty too. So we will make sure everybody gets a copy of the slide deck today with all of that stuff. And if you have additional information, reach out to your regional office. We'll make sure you get what you need.
Yes, and I just want to say for April, regarding that set of policy procedures to follow, that can be, you know, for the template for application for opera stabilization subgrants. I do believe that when we held in partnership, because we were supporting OCC for the Indigenous Peoples Conference, we did have tribal lead agencies who were successful with their subgrants that we could definitely support you with, because they lined it all out pretty easy, and we can provide you some steps definitely for assisting you with stabilization subgrants. So definitely reach out to us after this and we will support you.
Yes, and we will follow up on any of these additional questions that are in the chat right now. But I want to make sure we have enough time to introduce the folks that are going to give us a little bit of a presentation today on what's going on with the Kenaitze tribe in Alaska.
Yes, and I will try to for all the questions here too, I'll try to answer them as we are continuing. So I'll drop them in.
Thanks so much, Young.
No, thank you. And thank you for your questions.
Let's keep this thing moving. And we decided we're going to take a panel approach today. And like I said, we have a couple of representatives from the Kenaitze tribe in Alaska. Heather Schaefer is the CCDF administrator and Jennifer Aniston is the controller. And I'm going to give the floor to Jennifer and to Heather, just to introduce yourselves and tell us maybe what we see on this slide here. Jennifer, you're on mute.
Good.
There you go.
There we go. Sorry, you, Heather, you're on mute as well. There you go.
There we go.
My name is Jennifer Anderson. I am the controller for Kenaitze Indian Tribe. I'm new to this role. I was previously the accounting manager when we rolled out our program. And Heather is really the expert. I am just here for backup.
Okay. Thanks for joining us.
You're welcome.
Yes, thank you. So like Mike said, my name is Heather Schaefer. I am the CCDF administrator for Kenaitze Indian Tribe. I started shortly after the kind of ARPA information memorandum and everything came out. So I was lucky to just be in this pretty much from the start and get to work on all of this. So some information about the pictures you're seeing. These are all photos of one of our recent construction projects. So this is our Katanotana Do Deldet campus, or our education campus. And it is where we have our early learning wing, so our Head Start. And for the first time, we have early Head Start on site. And then we have a K through 12 Yaganin after school and summer program, along with a homeschool program, and we have some language classes, and we have a cultural instruction room, which was utilized for the first time this spring. They were stretching and tanning a moose hide in there. And you can kind of see we have in the gathering place, like the tribe's values wheel, and we have some just cannery wood incorporated, and within our building we have all of our signs have Denaina language and a lot of cultural ties. So this building is just really amazing to be able to have our kids and our education programs in here. So that's the background on that.
All right. Thank you. Beautiful pictures, by the way.
Yes.
All right. So as far as today's panel, Heather and Jennifer have received the questions from us prior to this today, and we're just going to go through and ask them a few questions related to all this fiscal stuff that we've been talking about. And again, if folks have questions they would like to pose to the panelists, we're going to probably give about 5 minutes for each one of these questions. And, you know, hopefully we can do a little back and forth. And so the first question for Heather and Jennifer, what successful strategies has your agency used to spend COVID-19 relief funds?
So I'll talk a little bit about our internal strategies and then kind of just touch on how we spent our funds. So internally, there were kind of, as people said earlier, a lot of team meetings. So our CCDF and education team, and then meeting with our finance team, just so everyone was on the same page of what we can do with the funds, and then kind of deciding what we wanted to do. And then as we got further down the road, we would meet to review together the application, the award letters, the quarterly reporting statements that we had providers fill out, just because we want to make sure we have everything in place and correct before we send it out. And I think even our award letter was reviewed by our legal team. So we just had those types of checks and balances in place. And then when the funds were going out, our fiscal system here, I would enter the check request and it goes through a team of maybe 3 or 4 people that have eyes on it and are always checking different spots on it, like the fund code, the provider, all of that. And the award letter would be attached, so you could easily see what month it was, what the amount should be, who it should be going to. And then Jennifer kind of mentioned earlier, we did try to lessen the burden on our providers and increase our integrity through paying the utility companies ourselves.
Right.
So they didn't have to worry about that, and we could just do that on our end and know the money was going where it should have been, you know, directly into their accounts. And then just talking on what we did with our money, we were planning to only have one award, and that changed a little bit, and I'll definitely touch on that later. But we decided we were going to award our funds to do a one-time payment as kind of a back payment for staff bonuses. So we determined it on number of staff and their hire dates, and we did $500 per month. So we had to request from all of our eligible providers their list of staff, hire dates. It's definitely a lot of configuring on our end, but we did a one-time payment. I think it ended up being 19 months. So it was from when, you know, the COVID ARPA funds were able to be spent to November 2021 of when we awarded the funds. And then we were able to provide a continuation of that in a monthly amount, the same $500 per staff, to go to our childcare providers to support their wages. And then additionally, we did the $250 a month for electricity and $250 for gas utilities. So that was our original plan, and we were able to figure it out where we would only have $5,000 left. And we had a plan for that too, just award that when it got closer, probably as utility payments. And I think I'll talk in the next question about
Okay.
why that kind of changed.
Yeah.
But I'll give Jennifer a
anything you want
chance.
to add?
Heather did a great job. I did want to just highlight, so from the accounting perspective, Heather mentioned the funds, and maybe a no-brainer. Of course, we're going to separate the funds, but we had a dedicated fund for each of our COVID awards. And then
Yeah, good idea.
And even within that, we had dedicated GL accounts and department codes so that we could really narrow down what was being spent and making sure that it was appropriate and accurate. So yeah, and I think what was really successful, helped us to be really successful, is that, you know, she mentioned those payments to the providers.
Yeah.
It took more work on Heather's end and then on the accounting staff's end, but we paid it monthly instead of giving a lump sum to the providers to help with their retention and recruitment. We did it monthly. So, you know, we're always reviewing what was going out and making sure that it was appropriate and it still met the needs of the provider as well as the requirements of the award.
Yeah. A lot of moving parts.
So many moving parts.
Kudos to you guys for keeping it as straight as you have.
Thanks. Thank Heather.
All right. Any questions from anybody else in the chat, or if you want to come off mute and ask anything? Otherwise, I'm going to move on. All right. Let's see here. Whoops, I went too far. Here we go. So we're interested in any challenges or barriers to liquidating or obligating these relief funds. And you've talked about some of it already. And then any TA support that you used or would like to have had to make this easier. We'd love to hear about that.
Sure. So as I kind of stated, we started awarding our funds in November 2021, and that ended up being maybe a little early, just not having all the answers right away or questions already asked. So that was definitely tricky at some times because we were ready to roll out, and then we would have some questions come up and then have to wait for the program office or for our federal partners, you know, to figure out the answers. But I still think it was good that we kind of picked a direction and started, because even though we tried to have everything answered, it was definitely, you don't know what you don't know.
Right.
So we just wanted to get the funds out to our providers as soon as we could. And it was definitely kind of intimidating to start because I feel like the ARPA funds can be so flexible, or it's so broad. So we did narrow it down to those two categories of the, you know, retention bonuses and the utilities, just so we could have more control and focus on what was going out and where the funds were going. But we still felt like it could support our providers in our community. And then definitely a big challenge, or an unexpected challenge, was we had originally 10 approved providers, and something just came up with one of them that they had to close their facility, you know, in the middle of the grant cycle, in our award cycle. So we all of a sudden had more than the $5,000 we were expecting to. So we had to regroup and just look at how we wanted to spend those funds and award those funds. And we ended up deciding, when we originally put out the application, the direction we were thinking of going was offering playground equipment, or maybe even a van for transportation, going on field trips. And providers were able to kind of mark if they're interested in those things. And when we got down to it, there's definitely a lot of logistics and moving parts in getting those items, especially to Alaska, getting playgrounds and who's going to install it and when. So we moved away from that direction, and we did get some feedback from providers that they wanted more funds or more flexibility to be able to purchase that type of equipment or to put towards their purchases for those things to support their facilities. So we ended up doing, for our 9 providers that we had, a payment for goods and services. And I think it was only like $3,500 per provider, but they were able to then look at what they really wanted in the goods and services category and make those purchases for themselves. And that was really great. And then of course we had, we thought we were done spending again, and then we had the reallocated funds, which is a good problem to have. But we just last week decided to open another application period and made it live. And we're looking at supporting our infant care in the area. And we're looking at doing it either again through goods and services or retention or recruitment funds specifically for those infant care providers.
Yeah.
And then as far as TA supports, I personally was on every webinar, every call that was held, just trying to get all the information, and then just attending with my questions and asking them and getting them out there. But I feel like the TA staff and our federal partners did a great job of continuing to follow up on those questions or updating us if it was just waiting at the program office for clarification and things like that.
Great. And of course, if you have the question, somebody else has got the same question, right?
You're right.
Right.
Jennifer, anything you want to add?
I just want to go back on it, and I know there was some additional questions about in our comments, but it kind of falls along with this as far as much as possible. So these funds were used to support our community partners because we wanted to, make sure that they were offering childcare because they impact so many of our tribal members and our employees, et cetera, to use those funds appropriately. But we tried to, and Heather tried to make those payments to the direct vendor. I just want to keep reiterating that. That was our internal control process, was that we would pay for the specific goods and services or for the utilities as much as possible, just so that we had good control over that the money was being spent appropriately and accurately.
Yeah, good for you.
The other just thought I had was that make sure you have good procurement guidelines and that you follow those regardless of what grant source. I mean, ARPA money and COVID money came out so quickly and so fast, and oftentimes we felt like we were playing catch up with the guidance behind it. But if you have good procurement guidelines in place to begin with, you're always going to be in compliance with the federal guideline. Well, I should, maybe always is too strong a term. You will generally be in compliance with all the federal guidelines.
Boy, it helps though when you get along with the procurement folks, doesn't it?
Yes, it does. Yes.
Somebody asked a question. I'm just gonna look at it quick. Andrea asked, did you ever have any of your providers have to repay funds back?
I don't believe so.
I don't think so.
We did have, we had that one provider who closed, but it was, we kind of got the notice of, hey, this is happening before the new, monthly payment went out. So that is kind of what helped us, is those payments were monthly. So it was able to be.
Great. All right. We're almost done here, guys. The next one, we're going to ask you if you can describe one program integrity strategy you used to ensure funds were spent in accordance with the regulations. And then there's just a plug here also for the tribal fiscal risk assessment. And a little later on, you're going to see a slide that has a link to this risk assessment. It's a thing that tribal agencies can go by themselves and take a look at and get some idea of how you might be doing in terms of what the regulations expect. But first, let's just talk about maybe one program integrity strategy. And of course, you know, one that pops up to me that you guys talked about a couple times already is paying the utility bills directly to the utility company.
Another one that they implemented right away was the application process. They had each of the providers that were interested in participating do an application. And then after the applications were vetted and approved, there was a signed agreement between the providers and the programs to make sure that, you know, you are understanding that you are accepting a federal award on behalf of, you know, Kenaitze Indian Tribe, and you agree to use these funds appropriately.
Fantastic.
Yeah, and then that was a part of our award letter. So we had that signed. And like I said, it kind of broke up the funds. It said the total amount, the monthly amount, what it was to be used for, descriptions. So the provider had that. It was attached with every monthly payment on our end. And then another kind of reporting system we did was quarterly reporting. So the providers had those payments every month, and then every quarter they had a report they had to fill out if they spent all the awarded money, if they didn't, why, and they had to fill that out and sign it and send it back before the next quarter started and that payment went out.
Okay.
So if there are any issues, we could pause and fix things.
Fantastic.
Mm-hmm.
All right, last question for today. We're going to ask you to share a fiscal accountability strategy used to ensure federal and tribal reports are completed accurately and timely.
Sure. So I think my best strategy is just to start early and to keep up on those tracking tools monthly. So we have, of course, I do the 700 report. So I have a big Excel sheet for our families that I update every month. And then for our ARPA funds, I had one as well. And it was broken up into, it had the demographics, of course, that we were told we had to obtain. And then it would have the full award amount, the monthly, and the monthly payments were updated. And that just allowed us, anytime we needed or met with accounting, you know, they could pull up their ARPA fund record and we could match the numbers, or if there was an issue, we could say, you know, what's going on here, and quickly figure it out.
Sure.
So I just think having those tools in place and keeping up on it, and then just starting early with the 700 report, it helped me a lot. I was able to get on the webinars after I had gone through it and confirm that I had done it the right way and I was understanding it, or come with my specific questions that I needed.
Sure. Great.
I think going back to that segregation of funds and just having a good accounting structure. So whatever system that you're using for accounting, we were using Microsoft Great Plains at the time. And again, so it's like, you know, we have our string of numbers. We're making sure that it's accounted for accordingly. It's also about collaboration between the program side and then the accounting side. We have a dedicated grant coordinator who works really closely with the programs, and she's responsible for all of the financial reporting. So lots of double checks and review, and yes, wholeheartedly agree to not wait till the last minute.
Great.
Regularly.
Andrea asked, and I don't know if you guys can answer this or not, but what was your average monthly subgrant amount per provider?
It's a little difficult to answer. It was $500 for utilities per month per provider.
Okay.
But then, and Heather, you might know the exact amount. It depended on how many employees the provider had, was the retention payments that went out. So
okay,
if it was one employee, they would get one retention payment. If they had, like, we've had our biggest daycare, I think, had 12, 13 employees. And so
Yeah.
they had the larger sum. So
Sure.
yeah, it's a little hard to answer right off the top of my head.
Okay. Before we close this out, Heather or Jennifer, any other tips you want to share?
Just don't be afraid to ask questions, reach out to other tribes and other agencies. And then the money is there. We don't want to give any of it back. I don't want Treasury taking any of the money. So get it allocated, get it obligated, and get it out the door.
Yes.
I agree. I think, you know, have your bases covered, but don't be afraid to pick a direction and move forward, and then find the answers that you need. Yeah.
Thank you so much for doing this today, both of you. I think your peers are really going to benefit from this. And I'm going to let you off the hook now.
Thanks for having us.
Thank you very much. And just a couple things to kind of close things out, folks. We want to give you some useful resources. We talked about this a little bit before. And so from a kind of a general program integrity standpoint, we have links here to the Office of Child Care COVID-19 resources landing page. Anything you want to know about any of these funds, CARES, SRSA, ARP, it's all there. Information on a specific info memo on ARP Act funds, and then Child Care Stabilization Grants landing page. And then we want to make sure that you also see that we have the Subsidy Center's Program Integrity Resources link. And this will give you information on any briefs or tools that we have created, as well as all of the program integrity webinars going back to at least 2018. So would encourage you to take a look at that. And then Young, I'm going to ask you just to maybe highlight a couple of the Tribal Center resources here.
Of course, Mike. So I will definitely do that. So obviously this is a very long list and there's a plethora of resources to assist you, but I did want to just highlight again out of this list, the Tribal Fiscal On Demand series, because that's where, you know, you can watch our videos regarding our budget template use, just lots of different things regarding fiscal management that are super helpful. And they do come with the talking points and everything in there for you. And it covers a lot of general topics on fiscal management in general, like, you know, so like definitely take a look at that. And I will have to say, even though it was on the previous slide, there was a Strengthening Stabilization Grant Integrity with Internal Controls that I just really want to point out, because it does have super great questions to ask yourself as a tribal lead agency to make sure you do have strong integrity and internal controls. And then lastly, again, as Mike mentioned earlier, the Tribal Lead Agency Fiscal Risk Assessment Worksheet that I would really recommend everyone working with their own staff to maybe try and do at some point, just to try it out, because it can help with mitigating any types of risks such as fraud and all those types of things. And I did put the links in the chat for you as well. And then lastly, just real quick, I would say make use as much as possible the ACF 696 Excel form for helping with reporting. I know we didn't really cover reporting, but just as a reminder, that's available for you to help with, again, monitoring and tracking for your COVID-19 supplemental funds, because you can use that in tandem with our budget template, which is described and gone over, which I will happily support you with on a call anytime you need me. But you can use those in tandem to help you really track and stay on top of things regarding reporting. So that's all for me, and I'll pass it back to you.
All right, thanks, Young. And so, folks, as you can see, I mean, lots of resources, right? Whether it's the regional office or the tribal center, your peers, there are a lot of people out there that want to make sure that we all succeed. So I hope you found this information useful today. We will make sure that everybody gets the slide deck, and that will have all those hot links to all of this information that we've been talking about today. and some of those really nice slides that the Tribal Center created that maybe you can just put up right in your cubicle. As we wrap this up, once we're done here, an evaluation will pop up. That's really important to us to help us determine what we should be providing in the future. So I think this was a perfect example. We kept hearing from people saying, we'd really like to have a webinar focused on tribal matters, and that's what we did today. So thank you for participating. Great responses. Thanks to our presenters today. And remember, technical assistance is a phone call away. So after you complete the evaluation today, if you need any help, reach out to the regional office, the Tribal Center, and get the help that you need, okay? Thank you, folks.